Hi, my name is Dr. Brian Maley, and I'm going to explain a little bit about a confusing area in medicine, that being the use of stem cells for cancer treatment. So as it turns out, the very first stem cell therapies approved by the FDA were actually bone marrow transplants, which were essentially stem cell transplants to treat blood cancers such as leukemia and lymphoma. What they did was they used chemotherapy and radiation to kill the cancer in the bone marrow, and then they would take blood or bone marrow, essentially bone marrow aspiration, which is the stem cells that produce the blood, from a closely matched donor, and then they would seed the bone marrow in the cancer patient and try to get the stem cells that would produce the blood cells to grow in the patient's bone marrow. This is in contrast to an immunotherapy protocol that we recently published in Frontiers of Medicine. So this uses the patient's own immune cells, which are harvested from the patient with a peripheral blood draw. It's an outpatient procedure, so there's no danger associated with it. It can be combined with any other treatment it can use for any other cancer. So it's completely different than a stem cell therapy for bone cancers or blood cancers. In fact, it's a immunotherapy using the patient's own cells in contrast to cells from a donor, and again, can be done on an outpatient basis. So it's an interesting transition from the original bone marrow transplant or stem cell transplant to where we are today with stem cells.